down?
You ready to
I'm
roll?
gonna pull this off because I can't talk. Well, welcome everyone. We wanted to get together as our Limestone County team, and we met this morning for a brief discussion to talk about it was time to give an update to the citizens of Athens and Limestone County. We have with us today Emergency Management. EMA is with us. We met at their office this morning. We have city officials, we have county officials, we have our medical staff with us today, and representatives from the Town Council of Mooresville and also the Mayor of Ardmore. So I felt like we're going into a July 4th weekend. It is a critical time, and we are a social people that love to be in touch with each other, to hug, to shake hands, and yet our numbers is going up the last few days by over 1,000 each day, and even this morning they're up over 900. So in Limestone County, we've had 4,233 people tested as of this morning, and we have 334 cases. Some friends of mine have personally tested positive for COVID-19, and there are some other areas in the community that some of you are aware of. So we wanted to give an update, not just from the political leaders, but most of all from our hospital staff. And we are, as you know, color-coded by state, by Dr. Scott Harris and the governor's office a week or so ago, and Alabama is an extreme state. I noticed today where Texas and Florida has gone back and closed their bars and maybe even looking at some of the restaurants. We don't want that to happen, and yet we've had some social events even downtown in Athens, and it kind of looks like we're trying to herd either cats or chickens. It's difficult to do, and I don't think any of us want to get to the point where we mandate to have masks out in the public. But if these numbers keep going up, then we have to make some tough decisions. I want to address the workers and the workforce at City Hall. I understand that came up at a press conference a little bit ago, and we have taken every precaution here at the City of Athens. We have glass up everywhere with people that can communicate with social distancing, and right at this time we are not requiring masks from our workers at City Hall, and if that becomes necessary, we will certainly do so. We have hand sanitizer out in the front. We have masks available for people that come in if they feel uncomfortable, but I want to encourage you to keep sanitizing, to social distance, and please take care of your loved ones. At this time, I'd like to call on Colin Daly as the County Commission Chair.
Thank you, Mayor, and I want to thank all the press for being here today, and the hospital for being here with us, EMA is here with us. We got representation from the Mayor of Ardmore and the City Council of Mooresville. You know, in Limestone County, we have 8 municipalities. That's one thing I am fortunate and thankful of. We all work well together. We all have to work closely, and a lot of times behind the scenes, people say, well, y'all not really out in front of people enough, but behind the scenes, we work well every day, trying to figure out what's best for the county, what's best as a whole. You know, like the Mayor says, I can echo what he says, the case numbers have went up. You know, we're up 41%. That's a major number. I mean, our hospital's done a great job, and I want to, you know, hats off to them. I don't know where we'd be without the great hospital facility in this county. You know, I just want to keep encouraging everyone. You know, I don't want to go to anything like a mandated mask or anything. I know we've had that conversation this morning. We watched the school board, you know, with their decision, what they're going to do, their press conference this morning. You know, I want you to, you know, if you go in a building, if you don't feel comfortable, please wear one. You know, we ask you if you want to wear one when you come in. You know, I go up to Clinton Street building. It's, you know, 50-50 shots. Some people have them on, some people don't. But we've done everything we can to protect our employees. We got a glass barrier up to protect us and them. You know, we're back open. We've got 6-foot distancing. You know, they're saying outside's the best place. So, like at the Clinton Street building, we're holding you outside until pretty much your time to come in. We're doing a 6-foot social distancing. If you're not able to do the 6-foot social distancing, we're doing the best we can. Like I said, the biggest thing is sanitize, wash your hands, good personal hygiene. A lot of it's good common sense. You know, just kind of, if you feel sick, don't get around people. You know, and like the Mayor said, you know, I've got personal friends right now that I have found out that, got this thing, and I mean, you pray for them every day, and I pray for our nation, I pray for our community, and, like I said, I just want to encourage everyone. We're going into the holiday weekend. I know everybody is like us, you're wanting to get out and see people. But try to stay with your family, try to celebrate with your family. One thing I can say about after this COVID thing has happened, I have seen children out doing things, like fishing and things like that. That's good social distancing. Get out. It's carrying you back to the childhood. Get out with your family, do things out in the yard. Spend time with your family, take advantage of this, and try and do the social distancing. And thank y'all for being here. And I don't know where I would be today without my staff and the people around us and the community and all. We live in a great community, and let's keep it that way, keep everybody safe through the holidays, and thank y'all for being here today.
Thank you, Colin. One of the things that I did fail to mention a few minutes ago is we have made a decision with Athens and Limestone County to have the fireworks next Saturday night. It's an important time, and I believe, again, that people are kind of starved for socialization, and we made the decision that by families staying together, staying in their cars, and so we are going to have that about 8:40 next Saturday night. I encourage you again to please keep your social distance and to sanitize. At this time, I would like to call on the Mayor of Ardmore, Mayor Shannon.
Thank you, Mayor. I guess we all more or less repeating the same thing, and Ardmore is very small, but I'm thankful for the area that we have. I'm thankful for the county we in, and it's a great place. We are at Ardmore, we're just trying to encourage social distance and sanitizing, and of course, as we've all mentioned, the mask, and that's strictly up to you. I think that's what we'd like to see it to stay. But if you feel better with a mask, then I think you should wear one. But it's kind of like the governor said, there comes common sense involved in this. We need to enjoy this, but at the same time, we need to make sure we keep our distance. 4th of July is big at us, big at Ardmore, big at our family. For Ardmore, it's big. It's not big to some people, but we do shoot fireworks and we have fun with that. But we are encouraging the citizens wherever we go. Our park is open in certain areas that go. We sanitize every day. But the important thing is, I believe, like everybody else has said, is the social distance and sanitizing your hand. And I thank you and I appreciate you for being part of it.
Thank you, Mayor. And we also are honored to have a representative from one of the oldest communities in the state of Alabama, and that's from Mooresville. And from Town Council, would you bring a few words to us, please?
Thank you, Mayor Marks. With our small size, Mooresville residents didn't have to get too creative in figuring out how to isolate and navigate the safe and safer at home guidelines. We have certainly welcomed and enjoyed watching visitors, especially families, using our quiet streets as a great recreational outlet to practice good social distancing. Our town size definitely has streamlined our communication efforts, but we can never communicate enough the seriousness of this virus and the necessity to sanitize and separate. Regardless of the size of any town, we as a county and the state are all alarmed with the steady upswing in the new COVID-19 cases since the economy reopened, and especially in the last few weeks. With the July 4th holiday approaching, we cannot stop heeding the warning of our public health officials, and we must understand that there's a personal responsibility to battle this virus. And I urge each of you to make sure that you're doing your part.
Thank you. And at this time, I'd like to have David Pryor, CEO of Athens Limestone Hospital, bring us some news. And David, if you have any words of not only encouragement, I tell you, some of us that wear these masks for a short period of time, my hat's off to the medical profession and the nurses and the other people that have to wear those all day long. God bless them, and I hope to goodness they're safe. So David, if you would, please.
Thank you, Mayor. It hadn't been long ago we were sitting up here talking about COVID, and we were talking about 150, 200 cases a day in the state, and we were very concerned about that. And as a mayor, mentioned a little while ago, we're regularly seeing 1,000+ new cases a day. So we are in a different world than we were just a few weeks ago. And I'll give you some stats in just a minute to kind of back that up. One thing I want to communicate, you have leaders at city level, county level, council level, and commission level, and just everyone talks about the same thing. Wash your hands, social distance, wear a mask. And the thing about a pandemic that we're kind of learning in the medical field is that people are getting information fatigue. Just like when the state closed the economy to do the right thing to flatten the curve, which we did, and it was painful. I think a lot of moms and dads learned how hard teachers work, and I know the gifts we give next year to our teachers will be a lot better than they have been in the past. They certainly deserve our praise. But I can't impress upon you enough the importance and the severity and the seriousness of this situation. I'm tired of it too. My hospital staff is tired of it, the community's tired of it, but I just caution you into not being careful as you should be going forward and letting us slide back into even a worse situation than we were in the beginning. So I'll just remind you that not just locally, but nationally, we're seeing a surge in cases, and in other states, Arizona, Texas, and as an example, the mayor mentioned that they're closing some of the economy now as they've learned in 4 counties in Texas that you cannot just flip a switch and think that it's not going to get worse. So we need to learn that lesson and be self-accountable for how we conduct ourselves in social environments, in stores, etc. I wear a mask, it's not comfortable, it's hard to breathe. But I tell you, if you saw a patient in our ICU on a ventilator, or patients who are prone to give them a chance to breathe, or the staff who spend 12-hour shifts in head-to-toe PPE to try to keep themselves safe so they can be there for the community when they need them at their worst, you would certainly do your part in preventing being another patient in the ICU that the staff has to go above and beyond to take care of you. So again, social distance. It's difficult. You have to think about it a lot. We think about the opposite, as the mayor pointed out, and the county commissioner pointed out. We like to congregate as part of our culture. We like to hug and shake hands. Fortunately, that's not the world we can live in right now and be responsible citizens. Washing hands effectively. Avoid contact with people who are sick. If you just saw a report on the news a couple days ago in Texas of a surprise birthday party, 18 people went to that party, 18 people got COVID. That's simple. And the gentleman who started the birthday party had a cough, but he thought it was related to his job and didn't think anything about it. So the only way we prevent that is just avoid contact with people who are coughing, showing signs and symptoms. And unfortunately, a lot of transmission can happen the first 4 or 5 days before symptoms occur. So there is spread prior to symptomology occurring in the patient. So what do we do about that? We wear masks. They're uncomfortable. I don't enjoy them. It's hard to interpret people's interaction when you're talking to them without being able to see their facial expressions. But it's a necessity, and I please encourage you to do that in public. Avoid crowds, especially if you're high risk of getting very sick. You look at the data, you read the news, and there are subset of population, whether it's demographics or disease states, that are susceptible to not just getting COVID, but getting the most severe outcome from the COVID, where you end up in ICU and on a ventilator and fighting for your life. So if you are at risk, emphysema, etc., please avoid social situations and stay away from people who might be sick. So a lot of information there. Go to cdc.gov or ADPH website for more details on that same information. So some of the stats. Johns Hopkins reports a new U.S. record of 39,972 new cases Thursday. So there's your national surge. Alabama had a new record of 1,146 new cases this week in one day. There's been 33,717 confirmed cases and 887 deaths. Some information I just got this morning is that the new estimated peak date for total active infections is not gonna be until September 1st. You know, that's still a ways away. So this is gonna be a marathon, not a sprint, and wear your mask for a week and then give it up. It's gonna be a while. Limestone County, 334 confirmed cases, but of note, 136 of those cases were in the last 14 days. So over a third, or within the past 2 weeks. That kind of gives you an understanding of what we're dealing with. From the HH Health System, across North Alabama, including all our facilities, currently there's 86 patients positive in the hospital, in one of our facilities. And 30 PUIs, or persons under investigation who potentially have infection. So that's a significant increase. At ALH locally, we have 4 positive inpatients. Some are in ICU, some are out on the floor in the negative pressure room. And that's the most we've had at one time since the outbreak began. So again, more evidence of a surge. Also more evidence of a surge is that of the people being tested, just a week or so ago, only 3% of those people were coming back positive. Recently, it's gone up to 9%. So there's more evidence that it's spreading. As far as testing goes, that's important that we continue to do testing and then contact tracing for people who are positive, but unfortunately testing reagents and kits and swabs are becoming more and more of a challenge for hospitals to get and provide those to the communities. On our patients, we've used all the therapeutic medications you've heard about. The remdesivir, we've used that. We've done convalescent plasma on patients, and I'm happy to report a result of our medical staff and the hospital staff working very hard. We still have 0 deaths in Limestone County. So it's a remarkable accomplishment to achieve, and I just applaud the staff at the hospital. We currently have enough ventilators, but we have partnered with the state and signed a memorandum of understanding yesterday to accept 4 or 5 new ventilators from the state and keep them at our hospital for our use if we agree to maintain them, and if there's a hot spot somewhere else in the state, within a 2-day notice, the state can reach out to us and ask for us to transfer those to that facility. So they've spread these ventilators from the state across the state to make them more easily, readily available to hotspots that pop up, and Athens is one of them. We talked this morning about visitation, given the surge. We had started to relax a little bit. I know it's still been concerning for people coming to visit. You like to come in as a family and see your loved one, and we've stopped that. We're reviewing our policy to see if we need to make it even more restrictive early next week. That's twofold. One, protect our patients, protect and the visitors, and also protect our healthcare workers. If I lose a lot of employees, and I have had, I believe it's 8 positive employees now in my organization out of 850 people. So if that increases or people get to the point where they can't work, my staff can't work, then they won't be there to take care of you. So we will be restricting visitation a little bit more next week. We need to protect our patients and our staff who are working really hard. So your part is to do what I started with. And I'll just go through it again. Social distance, washing your hands, avoid contact with people who are sick, wear a mask, avoid crowds, especially if you're high risk getting very sick. I can't say it enough. I know it's getting old hat hearing the same thing over and over, but it's up to each one of you and your personal responsibility to this community as a citizen to protect the people that you live with and your neighbors. That's all. Thank you.
David, thank you. I think you said it so well when you said so many of us is getting COVID-19 fatigue, but it is a very critical time, and I just stress again the importance of social distancing, and any of you that are dealing with folks that have, I have in my family COPD, which is extremely sensitive area, and to try to isolate that person. But is there any questions from the media? You have any questions? Anything that we didn't cover that you'd like to cover?
Questions?
Sure.
Question, so compared to Morgan and Madison counties, the cases are low here. What are you all doing differently to keeping the cases low and make sure that people are staying safe?
Well, I don't know exactly how that's relative to the number of tests that's been run, and David, I don't know other than, I don't think we're doing anything other than just trying to protect our people and asking them to be responsible. But as a comparison, I won't know how many tests have been run in Decatur and how many here to make that comparison. So, sorry, I'm not trying to dodge the question, but it's got some other variables there.
And excuse me if I missed this part, are you all considering a masking policy for there to be a possible fine if people aren't wearing their masks out in public?
No. Not at this time.
You said that the fireworks were still gonna go forward as planned, but with certain events like Fridays after 5, where you have large crowd gathered on one side of the courthouse or
Yeah.
on the streets, how is this affecting that?
Well, we had a huge crowd, and unfortunately, so many people, we tried to separate the people in the streets. We even marked spots on the streets for people to sit and ask them to congregate in families. And the first thing you knew is people were walking around the square, high-fiving, loving on each other. And again, it's a very difficult thing to try to control or patrol. And we need to look very seriously at those social events and see if we really need to go forward with them. Any others?
David, how many positive COVID cases have you had in the hospital throughout this time?
Let's see if I brought that stat with me.
Okay. Oh, David, they want you here. Sorry.
No, I did not bring that stat with me. We can follow up. If you'll just contact my office, we'll get you the total. Or any other stats.
And you said, there are right now 4 positive cases
Correct. In the hospital.
in Athens and Limestone.
Mm-hmm.
And are they all in ICU or?
No, 2 of them are.
Two?
The others are in isolation units with negative pressure rooms to protect the rest of the patients.
And again, I'm sorry, in the last 334, the last 14 days,
136 of those 334 happened in the last 14 days. And they're just numbers. In stats, I had a whole book of numbers I could bring you. The message to remember, not just stats, is they all point to one thing, is that this is getting more serious. And again, I think the fatigue of the closing down the economy and trying to limit social interactions is starting to fatigue people, and unfortunately I think a lot of people are giving up. That's fine. The hospital will be there, the system will be there to take care of anybody who gets sick. My concern is if we hit a capacity, either locally or across the system, or even the state in regards to ICU beds, that becomes another issue. Then your attention may be a little bit more drawn to what you need to do on a personal level, because maybe resources are not as available as they could be if we see a continuing of the surge. So we have a chance to prevent that, but it's rapidly spiraling in the wrong direction.
David, did you mention a question about September 1st? What was your comment about?
The expected peak date for total infections is now September 1st. Back when this broke out, early March, they were projecting that our peak date for Alabama would be late May, mid-June. And here we are, late June, and now they're saying September 1st. Imagine what happens August 30th, and then it becomes January. Then we're in flu season, and this is not the flu. It's not the China flu, it's not the flu, normal flu that we see. You can't take it light. The mortality rate is much higher in COVID-19 than it is with the flu.
If there are no more questions, this will conclude our press conference, and I appreciate everyone being here. We'll try to keep you updated, but again, I don't know that the folks want to hear from the politicians. We need to hear from the health officials and I appreciate David for being here, and Rita, thank you and your staff for pulling everything together. We appreciate it. Be safe.